Hi, I'm Angela Broom. I'm here to talk to you about cirrhosis. Cirrhosis is an end-stage liver disease that is caused by many different pathology pathways. Some of the pathways include non-alcoholic liver disease, autoimmune hepatitis, and as well as any of the hepatitis A, B, and C. To better understand cirrhosis and its implications on someone's overall health, we need to first look at the functions of the liver and how important this vital organ is to homeostasis. Liver functions include secretion of bile, emulsifies the fats, it metabolizes, it processes our carbohydrates and our fats, stores carbohydrates as glycogen to be processed by the citric acid cycle for energy for later use. Also stores fats as triglycerides or lipoproteins. It also detoxifies our body from any body waste and hormones, as well as drugs and other remote compounds. It synthesizes proteins, and it helps with the blood clotting factors by it's a helper organ for kidneys for the activation of vitamin D, and it removes bacteria and red blood cells. It's a helper organ in our immune system. It's also considered a gland. Production of thrombopoietin is help in clotting factors. The liver blood flow, the liver receives its blood from is in direct contact with two blood sources. One is receives arterial blood from the heart, feeding the cells oxygen-rich blood, and it also receives venous blood from the GI tract, and that is where it receives nutrient-rich blood. The venous blood enters the liver by the hepatic portal vein. The liver receives nutrients from the GI tract and is like a processing plant. It processes the products, it breaks them down, it processes them, it distributes them to their appropriate places. It's like storing glycogen, like I said, storing glycogen for later energy use, lipoproteins. The process of proteins can be broken down into fat by the citric acid for fatty acids, and eventually ketones. It detoxifies the products and removes waste or harmful substances before it reaches the bloodstream. This is the liver cellular structure. The liver cells are called hepatocytes. They're arranged in functional units called lobules. And they are hexagonal columns, as you can see. And they are surrounded by a triad, which is right here on the top, a triad. And which are a branch of each of the hepatic portal vein, hepatic artery, and the bile duct. Blood flows through the lobule into spaces called sinusoids. These sinusoids are lined with Kupffer cells, which are macrophages that help engulf bacteria and remove harmful substances before it reaches our bloodstream. Liver cirrhosis is an end-stage liver disease and is caused by several different pathways. Like I said, it can be from hepatitis A, B, or C. It can be autoimmune hepatitis. It can be non-alcoholic steatohepatitis, which is NASH, and non-alcoholic fatty liver disease, as well as alcohol fatty liver disease. It can be developed from poor lifestyle choices, from being obese, from alcohol and drug addiction. It can also be brought on by sudden trauma to the liver or injury to the liver. The precursor to cirrhosis is fibrosis. The disposal and formation and development of network of capillaries of the liver sinusoidal endothelial cells. Did I do it wrong? Sorry, I think I moved my slide back here. Cellular cells, those endothelial cells. And they destroy the dysfunctional liver cirrhosis. The activation of phagocytic cells, which forms the sinusoids of the hepatocytes of the liver and involved in the breakdown of red blood cells. They destroy the hepatocytes and stimulate the activation of hepatic stellate cells. Repeated cycles of apoptosis, the dying of these cells, and regeneration of hepatocytes contribute to the pathogenesis of cirrhosis. At the molecular level, many cytokines are involved in mediation of signaling pathways that regulate hepatic activation of these cells and fibrogenesis. The two primary factors contributed to non-alcoholic fatty liver disease are lipid accumulation and inflammatory response. The lipid accumulation, excess lipid accumulation in the liver leads to excess free fatty acids, and the inflammatory response causing the body to attack its own liver, leading to fibrosis tissue. Obesity is a key factor in non-alcoholic fatty liver disease. Obese people are more insulin resistant. Non-alcoholic fatty liver disease is defined as an excess of fat in the liver, which is at least 5% of hepatocytes display lipid droplets that exceed 5 to 10% of liver weight. The accumulation of fat in the liver causes a decrease in mitochondrial dysfunction. The mitochondria are big and swelled and sore and very scarce in number. The liver is unable to excrete the lipids effectively, and fat deposits end up in the liver, causing blockages that cut off oxygen to the cells, leading to apoptosis of the cells, and the decreased cells do not allow the liver to process the fats, carbohydrates, and proteins efficiently. This leads to fat deposits in the liver, causing the fibrotic tissue to form, and it's the fibrosis that leads to cirrhosis. Non-alcoholic fatty liver disease is a pathological change distributed by accumulation of triglycerides and is commonly associated with obesity, type 2 diabetes mellitus, and hyperlipidemia and insulin resistance. It has become the most common liver disorder in developed countries, affecting over 1/3 of the population, and concurs with increased cardiovascular and liver-related mortality. Non-alcoholic fatty liver disease and or autoimmune hepatitis diagnosis are pretty much the same. They're done by radiological studies such as MRIs, CT scans, laboratory studies for serum studies. They're somewhat different in what they look for. In non-alcoholic fatty liver, they actually look for do CMPs. They try to do liver studies, lipid profiles, and with alcohol immune hepatitis, they look more in the antibodies. Liver biopsy to determine the progression of the disease, and defining clinical markers. And this is a example of a CMP. And this, if you look down in the ALT and AST, those are your liver enzymes, and they look for elevation right there, and that helps determine if you're experiencing some sort of liver dysfunction. Some of the other clinical markers are increase in waist circumference, high triglycerides, hypertension, fasting high blood sugars, low high density lipoprotein, and insulin resistance. The key factor is the most common risk factor for non-alcoholic fatty liver disease is the insulin resistance. The prognosis, there is no current cure, but it is treatable with diet and exercise. Now, autoimmune hepatitis. Autoimmune hepatitis was formerly known as chronic active or active chronic hepatitis when it was first discovered in the 1940s. Chronic active hepatitis was thought to attribute to persistently destructive virus infections in the liver. In the 1940s and the 1950s, the autoimmunity was unrecognized, mostly because it was hardly ever heard of and because there was a lack of necessary laboratory procedures such as serum antibody testing and liver biopsy. And as the medical community began taking notice, autoimmune hepatitis was first applied in 1965 as a descriptive term. Autoimmune hepatitis defining characteristics of autoantibodies such as anti-nuclear antibody, ANA, smooth muscle antibody, SMA, and liver-kidney microsomal, LKM antibody. One of the pioneers of this discovery is Dr. Adrian Rubin for his published work, Landmarks in Hepatology. They have discovered that there are two types of autoimmune hepatitis, type 1, adult-acquired, and type 2 are in children. Even though type 2, adults can develop type 2, it's more common in children and young people. And type 1 is the most common type of the disease. It can occur at any age, and about half the people with type 1 have some other autoimmune disorder, such as celiac disease, rheumatoid arthritis, or ulcerative colitis. Some risk factors of autoimmune hepatitis. One, the most common is female. Even though men can get autoimmune hepatitis, it's more common in the females. If you have a history of certain infections, and if you have any other autoimmune disease, you're at risk for autoimmune hepatitis as well. Complications of non-alcoholic fatty liver disease and autoimmune hepatitis include esophageal varices, as you can see in the top right-hand corner. It is caused by the circulation of the portal vein being blocked by the inflammation of the inflammation, causing the blood vessel walls to be thin and they're filled with more blood. This can become life-threatening if the bleeding it becomes massive. And another complication is ascites. As you can see in the lower left corner there. Ascites is a fluid buildup in the abdomen. This can lead to breathing difficulties and usually is a sign of advanced cirrhosis. Of course, any kind of liver failure and liver cancer as well as complications of these two disorders. Some of the signs and symptoms of non-alcoholic fatty liver disease and autoimmune hepatitis is fatigue, abdominal discomfort, jaundice, that's you can see over there in the top left, and yellowing of the eyes and yellowing of the skin is a clear sign of non-alcoholic fatty liver and autoimmune hepatitis. An enlarged liver. Spider angiomas, they're little blood vessels that are open on the skin. Joint pain and loss of menstrual periods in women. Prognosis for cirrhosis, it's a permanent progressive disease. Treatments are centered on slowing the progression, and treatment of the disease process is caused by liver cirrhosis such as hepatitis, diabetes, and hypertension. Overall, it's medically dealt with dietary and healthy lifestyle changes. In here, I put in this slide of the different stages of liver disease. You start off with the healthy liver, then it goes to the fatty liver, and then it goes to liver fibrosis, which is a scarring of tissue in the liver, to eventually cirrhosis. The treatments include weight loss and combination of calorie reduction. Steroid treatment, prednisone, even though this is not considered, they use this for steroid treatment for non-alcoholic fatty liver and in autoimmune hepatitis. Steroid treatment, they don't use it for a very long time though, because it can cause other complications such as diabetes. It can cause hypertension, osteoporosis, glaucoma, cataracts, and of course weight gain. They start off on a very high dose, and then they wean you off to it's a very minimal dose that, and some people never come off of it. They have to stay on it for a lifetime. Of course, sometimes the doctors will use vitamin E because of its antioxidant capabilities, but mostly they usually treat this with dietary and lifestyle changes. You have to lose the weight. Weight is a biggest common factor for liver disease. If the steroid treatments no longer work, the final option for a patient with end-stage liver disease is, of course, a liver transplant. And they have, the doctors do 2 different kinds of tests scoring to determine if a patient is a liver transplant eligibility. One is the child Pew score, and the other is a MELD score. And I put in a picture of a liver transplant tissue expansion slide to give you a look at what the liver tissue would look like in a transplant. The child Pew score, there are 5 clinical measures of the disease, and the examiner gives a score of 1, 2, or 3 for each of those. The 5 clinical measures that they use are total bilirubin level, serum albumin level, prothrombin time, of course, ascites, and the presence of ascites and hepatic encephalopathy. If the ascites is none, then it's a 1, which means it's mild and diuretic response. If it's mild or diuretic response, it scores a 2, but if it's moderate refractory, it scores a 3. Once the scores are available of all the 5 clinical studies, then the scores are added, and the result is the Pew score. The interpretation of the score is if you're class A, you're 5 to 6 points. Sorry, I moved that line. 5 to 6 points, and which means you're least severe. And it's a 1 to 5 year survival rate, which is about 95%. If you're class B, it's 7 to 9 points. You're moderately severe. Your 1 to 5 survival rate is about 75%. In class C, it's 10 to 15 points. And your most severe and your 1 to 5 year survival rate is 50%. The other scoring method is called MELD, which is Model for End-Stage Liver Disease. It scores to prioritize adult patients for liver transplant. It is used as a severity index, and it indicates mortality risk and case urgency. The score is calculated mathematically with the formula using lab results. Calculated with the formula are the total bilirubin, the international normalized ration, which is INR, and the creatinine. The 4 MELDs are greater or equal to 25, you're gravely ill. If you're 24 to 19 or 18 to 11, you're just 24 to 19 is just a little bit below grave ill, and 18 to 11 is this next 3rd step. But if you're less than or equal to 10, then you're less ill. Patients with end-stage liver disease are tested on a continuing basis to determine their continued eligibility. Greater or equal to 25, they get lab reports every 7 days. 24 to 19, they'll get a lab report every 30 days. 18 to 11, every 90 days, and every 10 or less every year thereafter. I chose cirrhosis because in 2012, I was diagnosed with cirrhosis. I presented to the ER with complaints of chest pain. I was put through a series of tests. Of course, the test showed that my cardiac workup was negative, but the doctor was very concerned with my liver enzymes. At this point, I'd never had my liver enzymes checked, on a routine basis, and he was concerned that they were very high and that I had abdominal pain as well. And so he went ahead and did a CT scan, and it did discover my cirrhosis. I was treated and released and sent to my doctor, and I've been under doctor's care since 2012. And cirrhosis has, since I've been under the care, I'm now 8 years past my original diagnosis. So I'm beating the odds. And I am still working on my management of cirrhosis, and I'm working with my doctors and with my support group, which is my family and my friends, and with my faith in God. I would not do this without him, and he has been my go-to, and I see, with my family and friends surrounding me, I see a very bright future for me. Thank you for listening, and I hope this helped.